Welcome to our International Day of Older Persons celebration and our second annual Circle of Care Awards. For those who attended last year's inaugural ceremony, this virtual experience may seem a little bit different. On March 11th, 2020, the novel coronavirus was officially declared a pandemic, and New York City quickly became the epicenter. Schools and businesses closed across the city as hospitalizations and unemployment rate skyrocketed. While most worked from home and Zoom meetings from your comfy couch became the new norm, heroes on the front line had to charge toward New York City's most vulnerable. Today, we would like to honor those heroes.
Thank you again for joining us in celebrating our Circle of Care honorees and the United Nations International Day of Older Persons. You can find a recording of this ceremony on Facebook, Twitter, Instagram, LinkedIn at CABS Homecare. On the behalf of CABS, have a great day and be safe.
The Circle of Care Award goes to Mrs. Kathleen Pitt-Calizer.
Miss D worked really closely with my mom, and my mother had like an affinity for her. You know, I think she was kind of like the older daughter, and I don't know if people may or may not know, I did have a sister, and she passed away at 3 in front of my mother. So I think a part of how she loved people, especially those she worked closely with, such as Miss D, for her, I think the age group was similar to what my sister's age group would have been. And I just remember her being on the phone at nights with her, maybe talking about paperwork.
June, she come in away, she asked me, "Hey, Gary, you know what happened away?" I say, "What happened?" He said, "I want you to go to school." I say, "For what?" He said, "You want to be there, speak good English, something over like that. I want to send me for school." I don't play, you know, he keep calling me my house. "When you want to go, Gary? When you want to go?" I say, "I'm going, I'm looking something over like that." He said, "Whatever, I'm working 7 days for CAB." He actually, "You know what happened, Paul? I want you to take 1 day off to go to school."
Like I said, Ms. D helped me to not carry that. I think that would have been so much harder if I wasn't able to put that down. I was able to carry that differently, being reassured that my mother understood, you know, even though at certain stages it might not have felt that, like, your mother loved you regardless, Alex, you know. Even though you think you thought she might have looked at you in this light, she still always spoke of you like this, and she still always felt like that about you. And that was so needed. That was so needed because, again, there was no formal goodbye, and it was hard to hear everybody having all these other stories about my mom. And I was just like, wow, I feel like I'm finally at a space in my life where I would have been able to connect with my mother differently, and I didn't get to have that closure. But I do rest in the fact that I know she came, she saw, she conquered, she left a mark. There's stories everywhere from everyone. My mother was graceful. She was classy. She was very sophisticated. Everything she did was with such class. I mean, she even wore sweatsuits with heels. Okay, for real. She so even if she was here to receive this award, it wouldn't have even been her. I could have even seen my mother bringing up her work staff, her immediate staff. I would have seen her accepting the award even with her team, kind of a thing. Like, this is not an award for just me. This is a representation of my team and what, you know, what we have done. You know, being a director of patient services is one thing, but you cannot, you know, not everyone is born to be a leader. It takes a lot. It's not just about being, you know, it's not a dictatorship kind of a thing. And she didn't let the title get to her head. That was not of importance to her. Not that her job wasn't important, but it wasn't like, because I'm the director, I'm here and you're here. I never got that from my mother. She I got a sense in just how she spoke to her staff that it was, we collectively are doing this. This is a representation of us as a unit, or you guys are all a part of my team. It is not me over you. It was never that. So I do believe in accepting that award. She would have done it with the same grace and the same class and the same recognition to her staff, because there's no I in team kind of a person, and I believe that's how she would have received it.
The Circle of Care Award goes to CABS Nursing Department.
As Assistant Director of Clinical Patient Services, I'm basically in charge of the clinical department. So I work with a group of nurses that provide nursing care. We provide nursing care to our clients. We collaborate and coordinate the client's care. And actually do patient teaching, and actually do health promotion. So we're basically very focused on, we are patient focused, and we are highly, we are care directed, and actually we focus on preventative care. Our goal is to keep our clients out of the hospital, to increase our clients' status, clinical status, and health improvement. We do a lot of patient teaching, a lot of collaboration with the aide and the clients. We include our clients as part of the care plan, and basically do like a circle of care. So the circle of care approach is in patient focus. Is really the direction that we're going. So the World Health Organization has claimed this 2020 as the year of the nurse, and nurses and midwives, and I can honestly say that that we deserve it. And nurses have proven that their dedication, hard work, and commitment to nursing, to patient care, to our client care and well-being. And I think that our nursing theorists like Florence Nightingale, that has worked through on crisis and has proven that nurses are heroes. Nurses are constantly working and risking their own lives for our clients. So I'm proud to receive this award. I'm proud to be a nurse and to be part of this, to be nominated as Nurses of the Year. I really think that 2020 is the year of the nurses.
And now, a short presentation from the Brooklyn Borough President, Eric Adams.
Hello, I am Brooklyn Borough President Eric Adams. It is my pleasure to bring greetings to CABS Home Care Services and acknowledge 41 years of service in the healthcare industry. And I especially want to congratulate this year's Circle of Care Award honorees. The World Health Organization has designated 2020 the International Year of the Nurse and the Midwife. And it's most fitting that your honorees this year include nurses, home health aides, and senior center program managers. I join CABS in acknowledging your 9 honorees for their commitment and dedication to quality health care for Brooklynites in need, especially throughout this COVID-19 pandemic. It's never been more clear how home care services are critical and how those on the front lines performing life-saving work every day are truly essential. I salute our borough's healthcare workers for the care and attention they provide our seniors, the matriarchs and patriarchs of our families and our communities. They need and deserve the special care during their golden years that you provide for them. Their continual good health and well-being prolongs and enriches their lives. The quality of life, physical, mental, and emotional health is greater because of highly skilled and compassionate caregivers like yourselves. As Borough President and on behalf of a grateful borough, I commend you and I thank you for your service.
Good afternoon, everyone. I hope you're enjoying our program today. My name is Shirley Demosthenes, CEO of CABS Home Attendant Service. There's no place I'd rather be than to celebrate a decade of healthy aging and women on the front line in healthcare. And hey, that includes me. Congratulations to our honorees. Well done. You truly, truly complete my circle of care.
My name is Ashley Watson. I work in the Business Development Department at CABS Homecare, and I am the Special Program Analyst. I think healthy aging at this point in time, in addition to being active and getting on a treadmill, I think is just keep moving and pressing forward. So whether doesn't have to pretty much mean physically, but spiritually, emotionally active, whatever keeps your brain moving at the time. So whether it's picking up a book, whether it's music, whatever it is that keeps you out of the funk is what is healthy aging.
The Circle of Care Award goes to Clarice Johnson and Isadora Jermison. And now, a short presentation from Assemblywoman Latrice Walker.
Hello, Circle of Care. I'm Assemblywoman Latrice Walker, and I proudly represent the 55th District right here in the great state of New York. Congratulations to CABS Home Care Service on 41 wonderful years in the healthcare industry, and a huge congratulations to this year's Circle of Care Awards honorees for their dedication to the healthcare industry, especially during the COVID-19 pandemic. I am most appreciative of the work that's being done in the greater Ocean Hill-Brownsville community, and special acknowledgement to R.D. Brown. This year's honorees includes nurses, home health aides, senior center program managers, health plans, and others making a difference in our community. Aging in place tends to improve seniors' quality of life and their physical and mental health. Home is where the heart is, and it's a time-honored tradition that familiarity, comfort, security, and home are always kept in hand. Aging in place allows older adults to stay in a familiar and cherished place. This is a critical and underrated factor in a senior's quality of life. Lifespans are extended every year because we are living better and longer. Thank you again, and congratulations again to CABS Home Care Services on the Care of Circle Awards, and most importantly, this year's honorees. Again, I am Assemblymember Latrice Walker. God bless you.
Hi, how are you? First of all, thank you so much for allowing me this opportunity to speak to you about my agency, which is God's Love We Deliver. We are very appreciative, and we thank so much CABS for allowing this opportunity to share with you the work that we do in providing meals to people who are too sick to cook or shop for themselves. Excuse me, we've been around since 1985, and that's our location. We're based in the center of Soho, which is just below Houston Street. We're on the corner of 6th Avenue and Spring Street. And what you see in the screen right now is one of our volunteers, a lady who's been with us for a number of years, helping to prepare those meals that we will provide to you or someone that you know who may be too sick to cook or shop for themselves. Can we go on to the next slide, please? As I mentioned, we're somewhat like Meals on Wheels, in which we provide meals that are already prepared. We bring them right to your door. Our meals are intended for people who are too sick or crook to shop for themselves. And generally, someone has a serious health condition. Maybe they have heart disease, high blood pressure, severe diabetes, multiple sclerosis. Maybe they have cancer or HIV. But a serious health condition. And I think you see on the screen here that some of the things that you might look for: someone who suffered weight loss, someone who has dementia. And generally, our meals are for people with a serious mobility problem in terms of getting around to cook or shop for themselves. Let's go to the next slide, please. The service, though, is pretty straightforward. Here again, the meals are prepared on site. We bring the meals to a person's home, and we also provide ongoing nutrition, education. Everyone talks to one of our stable nutritionists that are on staff. And if there are changes in your diet or your menu, we encourage you to speak to our staff about making that happen. And all you have to do is pretty straightforward. We make the meals, you store them in your refrigerator and your freezer, you reheat them, and we just want to make a point that our meals are low in sodium, our meals are frozen and chilled when we bring them to you, and a person can get our meals if they have a home. If they're in transitional housing, that's fine. If they're in a shelter, that's fine. We deliver from public housing to Park Avenue, I like to say. But our meals, unfortunately, if someone's homeless at the moment, then we have to presume that they don't have a microwave oven or the ability to store those meals. Next slide, please. My contact information is here. My name is Ralph Wilson. Please feel free to call me at 212-294-8121, or you can email me at rwilson@glwd.org. Now, by all means, we also know that there's a lot of concern about COVID-19 and the impact that it has on our communities. We take that very seriously here at God's That We Deliver, and we just want to assure you that we've instituted some protocols and changes in our processes so that all of our staff wears a mask when we interact with others. All of our drivers wear masks and gloves. We've created a contactless delivery system where the meals are left in front of the door or on a doorknob, so that there's no concern about interacting with someone who may or may not have the virus. So we just want to assure you that we respect your safety, and we are doing as much as we can to ensure that there are no problems in that regard.
The Circle of Care Award goes to Mary Watson and Maria Seda.
When I go to the office, the girl was telling me something, and I said, "What?" So she said, and I start to cry first, and the girl in the office said, "Miss Watson, don't cry, you're a nice person. Everybody in there like me. I show them respect, no care how young them is, and I do what I have to do, and even the people and what I work for, I show them respect, and I do what I have to do. I don't drink, I don't know anything about them things. Drink, smoke, and those things. I never do it. Because I grew in the West Indies, and my parents was very poor. And we have to go out in the field most of the time, plant the tomato, the scallion, the onion, the this, and go to market and sell them. So I grew I was very, but thank God I come here and I do what I have to do. I work, I respect the people I work for. I respect the people where I go into the house and work, and I respect those in the office. Thank you, CABS, for this award. I love CABS. I love CABS to my heart because I raised 4 children there. And I love everybody that's worked there. If I was working for another agency, it's the same thing I'm going to do like what I do at CABS because I'm interested into, I am ageable too, and I'm interested into people. And if you want something, even in the building here, if somebody upstairs wants something and them can't get it, I go buy it and bring it and give them. Sometimes I just buy it and give it to them. So that can't come out of me because I go that way. I go that way.
The Circle of Care Award goes to Maria Rodriguez and Angela Chow.
Hi, my name is Maria Rodriguez. I'm the director for Independent Senior Center. I've worked here almost 6 years. I work for Millennium Development. I started off as assistant director, and I was assistant for a year and a half. And after that, they made me the director. So my seniors love me, I love them, and we try to keep them happy and busy all day long. Healthy living to me for the seniors is keeping them healthy, keeping their minds occupied. When they come here to the center, when it was open, they had their bingo, they had their dominoes, we have yoga, Zumba, they keep busy, they love dancing, we have parties. Right now we're doing everything virtual, so all the classes are virtual. And today we had a cooking class, so I had like 15 people watching me cook in the kitchen. Color makes everyone happy. My seniors love color. When I came here 6 years ago, everything was gray. There was no color, nothing on the walls. It looked like a hospital. So since I've been here, I've added my touches. I know they like their colors, and it makes them happy when they come in. So you should come in for Christmas to see how it is in here. Thank you, Circle of Care. Thank you so much for my award, and I hold it very close to my heart forever and ever. Thank you. This is my first award, so it's close to my heart, and I'm going to dedicate it to my mom, who I just lost this April, and to my oldest senior, who was 108, and I lost her in June. So this goes for them. It's beautiful. Thank you so much.
Angela Cho.
Alfredo Gutierrez.
With PP for NYC. We were in our living room, dining room actually, and I was feeling restless, like we need to help, we need to do something. This has never happened in our city before, and so many people want to help, but it's chaos and it's disorganized. No one knows how to help, especially if you're not in the medical field. You kind of feel helpless. And well, our really good friend is a doctor, and so we just got her kind of personal stories of what was going on with COVID. And so she helped us in terms of the knowledge space of that field. Like, here's all the PPE we need. Just kind of fact checking our website because we really didn't know, right? But yeah, that's how we kind of felt a little comfortable diving into a topic that we just really didn't know anything about. But yeah, we learned a lot. We expected donations to pour in, like kind of, for me, I expected this, like little by little, but actually it came like in waves, like huge donation, like thousands and thousands of pieces from one person. And then it would happen again, and just, we didn't expect to move thousands, like tens of thousands of pieces of PPE, and also to meet such incredible people along the way. Yeah. It was just an experience that we didn't expect, because we ran into this without really a plan, which was a little scary.
For me, I'm from Boston, and I don't really know many people around, and like my experience in New York City, it's cold, it's cement, it's, you know, it's just what it is, and it was just awesome to feel and see so many people working together, and like your organization and everyone just trying to help, like coming together. This is our common enemy. Let's take care of each other. And so many donations.
It was beautiful.
Many.
Like,
we still have
beautiful.
boxes in our garage. I'm like,
I know,
what do we
it's
do with
still
this?
coming. And mystery donors, like people who don't even
aren't
want the
asking.
credit, and they just drop it in front of our house, and we're like, what? A lot comes to mind there, where I think whether we're of any age, we can tend to forget to take care of a certain part of ourselves, and whether it be staying connected with loved ones or going inward and taking care of self. Healthy aging of all ages is to make sure we don't neglect our physical selves, our spiritual selves, and our emotional selves, and living whole every day.
Yeah, and I think the message of positivity is such a big part of that, because just like I'm a big fan of cornerstone habits. You know, you start going to the gym and you just naturally start eating better.
Right.
You know, and you start just naturally feeling better and all of that, right?
Yeah, everyone has a role, a different role in the circle of care, and for us, it was, in this case with PPE, it was an actual literal connection. It was a connector of people who wanted to help and give care, and giving it to other people who have a system of helping, like CABS, and it just became like we all need to be connected in a way of giving back. And everyone has a different role, and that's beautiful. Yeah.
And now a message from Senator Roxanne Persaud.
Hello, I'm State Senator Roxanne J. Persaud, representing the 19th Senatorial District in Brooklyn. I'd like to congratulate CABS Home Care Services on their 2020 Circle of Care Awards ceremony, an award ceremony where they acknowledge the diligence of their workers, their workforce, who have, particularly in the year 2020, been on the front lines during this COVID pandemic. CABS Home Care is also acknowledging the UN's theme, where they're acknowledging the midwives and nurses, primarily women, who have been on the front line. Thank you, CABS Home Care, for acknowledging these diligent workers. To the workers who are being honored, congratulations and thank you for your service. To Mary Watson, who was given 49 years of service, congratulations. Isadora Jermison, congratulations on your 17 years of service. Clarice Johnson, your former home health aide, 25 years of service. Jeanette Scafidi, a social worker, congratulations. We need our social workers. Maria Rodriguez, program manager, working at the Millennium Development Independence Senior Center, congratulations. Angela Cho, chief executive officer, PPE for NYC. Kathleen Pitt-Calizer, RN, posthumously awarded for 28 years of service. Thank you to Kathleen's family for allowing her to give 28 years of service. My condolences to your family. Maria Seda, 24 years of service. And to the CABS Nursing Department, thank you all for everything that you do, the long-term care of our elderly and disabled. Again, congratulations to CABS Home Care on 2020 Circle of Care Award Ceremony, and congratulations and thank you to all of your honorees. I'm Senator Roxanne Persaud, again saying thank you.
The Circle of Care Award goes to NYCHA's own Jeanette Scafidi.
I've been working with NYCHA for about a year and a half now. And prior to NYCHA, I was with Canberra Home Base for 3 years. I was the caseworker there for homeless prevention. And now at NYCHA, I'm a service coordinator and a caseworker for two senior buildings. I know one day I'm going to get old, so to help someone older and to get help that they need, it pleases me because I know one day I'm going to get there. My goal I would like to see is more help for the seniors. because, you know, sometimes they're afraid to talk because they're by themselves, or they don't have any family members that are there for them, and I step in and I take that place and that role for them. So with me advocating for them, it makes them feel comfortable and helps them get through their days a little bit easier. I'm not able to see my residents, and that bothers. Because when they see me, it brightens my day, and they give me knowledge. And when they see me, they feel, okay, somebody cares. And speaking to them on the phone helps, but then again, it doesn't because I'm not there physically, and they like to see that sometimes. Getting an award is an honor, but what's more of an award for myself is the fact is that I've achieved the help that they need. And that's what means a lot to me, and the award shows that. Thank you, CABS Homecare, for the Circle of Care Awards. I am truly, truly honored. I dedicate this award to my seniors, my NYCHA family, and of course my family. Thank you.
Greetings, everyone. I'm Congresswoman Yvette Clarke, and I proudly represent you in New York's 9th Congressional District, Central and South Brooklyn. During these times of heightened public health concerns resulting from the COVID-19 pandemic, it is now more important than ever that we come together as a community to ensure that the needs of our most vulnerable populations are being attended to. Specifically, I'm talking about our elderly, our economically disadvantaged families, and persons with disabilities who have been so especially vulnerable to infection by the coronavirus and the resulting conditions of social isolation. Although these are extremely difficult times, we are not without hope. Thanks to the diligent work of our first responders, nurses, doctors, and other medical professionals, we are winning the battle against the spread of COVID-19 and arresting this lethal virus that has brought such death and economic destruction into our lives as we await a tested and trusted vaccine to aid us in defeating it once and for all. That's why it's so comforting to know that for the past 41 years, CABS Home Care Services has worked tirelessly to service the healthcare needs of our elderly, our most vulnerable populations that have been hit especially hard during this pandemic. That's why, on behalf of the people of the 9th District of New York, I wish to express my gratitude for your hard work and sacrifice in protecting the health and well-being of our most vulnerable community members. Your work on the front lines in our communities must not go forgotten as America continues to battle against the spread of COVID-19. We are blessed to have had the professionals of CABS Home Care trained and prepared to meet this moment. We must always remember that in the darkest of times, it is our sense of unity and our commitment to protecting the vulnerable that will always carry us through. Thanks to CABS Home Care for being a beacon of light during such trying and uncertain times. As your representative in Congress, I have made it my mission to make equitable medical services the law of the land and will continue in the fight for healthcare justice and equity. So to all of you who have worked through the thick of this pandemic, sacrificing your time and risking your lives without the PPE and resources that you needed, we again express our most profound gratitude. To CABS Home Care Services, thank you for over 4 decades of dedicated service to our community. There is still so much work to be done to assure that continued quality medical services for our seniors and all of us who need it is a right and not a privilege. The fight for justice continues, and we are in this battle together. We will not stop now, and we will win. Much continued success to CABS Home Care Services. May you continue to provide healthcare services with dignity to those who need you the most. Stay safe, stay healthy, stay strong, and stay blessed.
Hi everyone, my name is Kara Rogers. I'm so excited to be here today to share a little bit about what Alzheimer's Foundation of America is. I just want to say thank you to CABS for inviting us for this event. So just a little bit about AFA and what we do. We're here to provide resources and support anyone who is impacted by this disease. Home healthcare workers, home healthcare professionals, individuals, family members, anybody who is diagnosed. We're ultimately here to be a resource to you and provide any education that we can at this capacity. Another side of what we do is fund research for better treatment and hopefully for a cure for this disease. We were actually founded by a caregiver. As you can see in the photo, this is Bert Brodsky, who is actually caregiving for and because of his experience of being a caregiver, he didn't want anyone to ever feel like they were alone when dealing with Alzheimer's. So this is what ultimately led to us being a lifeline for other people who are going through this experience so they know that we're here for them. This is just a list of some of the different programs and services that we offer. You can find more information about this on our website, as you see below. One of the things that we do have that might be very our Educating America tour. This is something that's being done virtually where you can register online and learn about the disease from different guest speakers that we are having, physicians, etc. So we're here to provide all of these services to you. You have questions, just give us a call about them. Specifically during this time, during the pandemic, we are offering programs and services in regard to coronavirus. You can go to our website to find information. Care for someone during this time. We have support groups during this time, especially for family members who might have someone living in a long-term care facility during this pandemic and are not able to see them. And our manager of therapeutic programmer, Jackie Gatto, is leading virtual community classes online. That's on our Facebook and our YouTube page that are free. And if you love them, you can keep rewatching them and replaying them. So as I mentioned, we have our national toll-free helpline. This is what I work on. So all of our helpline workers are licensed social workers who are trained in dementia care. So we're here to provide any support that may come up, to brainstorm, to listen, and really be there for you during your time of need when you call us. And there's no pressure to feel like you have to memorize anything because we're always here for you throughout the journey of the disease. And we also have our memory screening program. This will allow you to do it virtually. This can be for friends, neighbors, just to really start a baseline about it. Lastly, we do work within public policy to advocate for caregivers and families going through this disease, for resources for them, for funding for this research. And for this, you can connect with us and we can share your stories that can then be passed on to those governmental leaders who can then with others about what's really going on and impacting your life as a caregiver. that ultimately will lead to providing more funding and services. So you can visit our website at www.alzfdn.org. You can also call us at the number that you see, 866-232-8484. You can also chat us on our website. We offer it in over 90 different languages, so if you feel comfortable that way, we can service in that regard. Thank you so much for having us again. So thrilled to be here. Please feel free to reach out. And my name is Kara Rogers. I'm the social worker at the Alzheimer's Foundation of America. And you can connect with me specifically at krogers@alzfdn.org. All right. Thank you so much, everyone.
Well, I'm happy to be here. My name is William Andrews, and I'm the chairman of the CABS Homecare Company. And this is a great day where we are able to celebrate women that have been on the forefront of the health crisis in New York City, and in particular in minority areas, meaning Bedford-Stuyvesant, Williamsburg, Brownsville, East New York, to help them recover from the tremendous health needs. And CABS has been a leader in providing home care services to the people that are most in need. And it's been my pleasure to be chairman of this corporation, to oversee and see that the people that have been neglected the most are getting services. We're not able to provide all the services, but we do the best we can do under the circumstances, and that the people that work for CABS Home Care Services, they're very dedicated workers. Again, I'd like to extend a congratulations and a thank you for our our community partners that have supplied masks and PPE clothing for our workers and for the community. Again, with the shortfall and the things that have happened in the political climate, we're fortunate that CABS has a reputation that attracts community partners that from the banking community, from the health community, to provide some necessary tools that we needed to provide through this coronavirus. This has been a tremendous challenge, but again, I'm thankful to the staff and our leadership that we're being able to meet that challenge, and we'll continue to meet that challenge because we're all dedicated to this, overcoming this virus and providing health services to this community that we serve.
The pandemic was traumatic. And I don't mean that by it's a one kind of effect that happens. And when you hit with that kind of experience unexpectedly, we remain the guiding light for our workers, for our clients, because the pandemic became a war that we were fighting, an unexpected war, and we were steadfast to ensure that we provided the support system. I think that's one of the things that was important, because even though New York City went on pause, even though New York City shut down, it was important for CABS to figure out strategically how it was going to maintain service uninterrupted for our clients, because we know the majority of our clients depended on CABS to ensure that they received their personal care. There's certain activity of daily living that was important for some of our clients. We were their guiding light. We were their connection to the world. When the world shut down, we were available to our clients, our staff, and our home care workers. Our door was never closed. We were essential. We were essential, and by means of morale, and we were the pillar for many of our staff, and we show our appreciation for their dedication and commitment throughout the pandemic, from the onset, from the peak, and now there's post-COVID. The heroes work here. So let's talk about some of the exciting programs coming up at CABS. During this unprecedented times in our history with COVID-19, we are reflecting in the challenges and successes that we have had over the course of the pandemic. And while we celebrate our honorees of women in healthcare, we want to take note of some of the programs that we have that's on the horizon. CABS Home Care Health Home Division, specific focus as a care management agency, will be providing services to patients, including but not limited to coordination of benefits, advocacy, legal support, housing assistance, entitlements, and comprehensive medical follow-up. These are key areas of coordinations for patients who do not receive personal care services, but they are in need of having this level of coordination of services that can get them to realize what is important to stay on top of their care with the support required by our social worker.
Thank you again for joining us in celebrating our Circle of Care honorees and the United Nations theme of International Day of Older Persons. You can find a recording of this ceremony on Facebook, Twitter, Instagram, YouTube, and LinkedIn at CABS Home Care. On the behalf of CABS, have a great day and be safe. Remember, safety first.
You are our people, we are your team, for home care, health care, personal care, helping you back to the best you can be, for body, mind, and soul care. CABS is always there. CABS will lift up your humanity. CABS will help you live happily. CABS, oh yeah, we're gonna feel like family.
CABS Home Care, your #1 choice for home care services for the elderly and disabled. Visit cabshomecare.org to see how CABS can enrich the life of your loved one.